Hi there, I'm an emergency physician and I've got few items placed here on this table. Okay, which looks like some sort of ingredients to make a dish, but let's see what they are. This is coffee, ground coffee, rather instant coffee, and this is sugar, and that's honey, and that's salt, and this is talcum powder, and this is burnt cloth. You'll be surprised to know that these are the few items which people have been historically put into a fresh wound for two reasons mainly. One, to stop the bleeding, and secondly, to prevent any infection. But as an emergency physician, I would rather see a wound without any foreign item in it, because that complicates the wound healing and it causes infection. So the best way for a fresh wound, if you want to stop bleeding, is not to put any of these items like burnt cloth, which is ash, or honey, or sugar, or salt, or talcum, or coffee. No, in order to prevent the bleeding, the best way to stop a bleeding from a bleeding wound is to put a direct pressure on the wound and address it with some sort of bandage, and keep the pressure until you bring the patient to the emergency department and see a physician. If the wound in the beginning is heavily contaminated, so you just wash it with normal water, as much as clean water as possible, and cover the wound and bring it to the emergency department. Regarding the burnt cloth, the ash, especially it causes tattooing of the wound, tattooing of the skin. So I have seen cases where the wound has healed, but they are blackening of the facial skin because of the ash which was put into the wound when it was fresh. So all these items are strictly forbidden to put in the fresh wound. Just apply the local pressure to stop the bleeding, and just apply a bandage, clean the wound if it is heavily contaminated, and bring it to a physician in emergency department as soon as possible. Thank you very much.